What is chlamydia? Understanding this common STI. Imagine hearing about a health issue that often causes no symptoms but can lead to serious problems if ignored. That's what makes chlamydia one of the most common sexually transmitted infections around. It is caused by a bacteria called Chlamydia trachomatis and can infect both men and women. Because it often doesn't cause noticeable signs, many people don't realize they have it, which makes it easy to pass on unknowingly. This is why it's sometimes called a silent infection. Chlamydia spreads through sexual contact, including vaginal, anal, and oral sex. It can also be transmitted from an infected mother to her baby during childbirth, which can cause infections or pneumonia in newborns. When symptoms do appear, they usually develop within 1 to 3 weeks after exposure. In women, symptoms might include unusual vaginal discharge, burning when urinating, bleeding between periods or after sex, lower abdominal pain, or pain during sex. Men may notice a discharge from the penis, burning during urination, or less commonly, pain or swelling in the testicles. Both men and women can have rectal infections, which might cause pain, bleeding, or discharge, and infections in the throat or eyes can lead to sore throat or redness and discharge. If chlamydia is not treated, it can cause serious health issues. In women, it can lead to pelvic inflammatory disease, which may cause permanent damage to reproductive organs, increasing the risk of infertility, ectopic pregnancy, and chronic pelvic pain. Men can develop epididymitis, an inflammation of the tube that carries sperm, which can also affect fertility. Because of these risks, early detection and treatment are essential. Diagnosis is straightforward and usually involves laboratory testing of urine samples or swabs from the genital, rectal, or throat areas. Many clinics and health services offer testing, including self-test kits that you can use at home and send to a lab. Treatment involves antibiotics, which are highly effective at curing the infection. It's important that sexual partners are also tested and treated to prevent reinfection. Using condoms consistently and correctly during sex is one of the best ways to reduce the risk of catching or spreading chlamydia. In summary, chlamydia is a common bacterial STI that often shows no symptoms but can cause significant reproductive health problems if left untreated. Regular testing, especially for sexually active young people and those with multiple partners, along with practicing safe sex, helps control its spread and protect your health. If you think you might have been exposed or are experiencing symptoms, it's important to see a healthcare professional promptly for testing and treatment. Remember, taking care of your sexual health is a key part of overall well-being.